Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh. Hi, how are you everyone? Inshallah, in this slide, I'm going to share with you some information on the antidepressant and anti-anxiety drugs. Please view the slides together with the notes provided. The learning outcome of this lecture include the following. First, understand the different theories in the pathogenesis of major depression. You don't have to be able to explain in very detail, but you must understand so that you can appreciate how the drugs work. Second, list the different groups of antidepressants. Third, describe the pharmacodynamics of the drugs and a little bit on the pharmacokinetics factors. 4. Describe the clinical uses of this medication, not only in depression, but also in other clinical diseases where depression is part of the presentation. And of course, it's very important to know the different adverse effects associated with this medication. And finally, in this lecture, you will learn a little bit about the electroconvulsive therapy. Depression is a common complex mental disorder. Based on this slide, you can see the prevalence by mental and substance use disorder World 2017. And you can see that a significant portion of the population worldwide suffers from depression, second only to the anxiety disorders. Patients with depression present with different signs and symptoms. However, generally you can divide them into positive and negative symptoms. In this slide, it shows you some of the signs and symptoms that your patient might present, such as difficulties concentrating, feeling guilty, loss of interest, lack of energy, feeling of emptiness, low sex drive, and no motivation. Some patients experience changes in the appetite or weight. They might lose weight or they might increase their weight. They might feel worthless, have low self-esteem, have low mood, and no self-confidence. The signs and symptoms of depression affects patient's life. The pathogenesis of major depression is complex and still a lot of research is being done. In this slide, I'm going to share with you some information regarding the 3 common theories that is used to explain the development of this disease. The first one is the biogenic amine hypothesis of depression. Secondly, the neurotropic theory of depression. And the third one, the neuroendocrine factors. The biogenic amine theory explains the role of amine in the development of depression. In this slide, you can see a presynaptic serotonergic neuron and a postsynaptic neuron. In between, you have the synaptic cleft. When neurotransmission occurs, the serotonin that is released into the synaptic cleft will stimulate the postsynaptic receptors to mediate its pharmacological effects. After it has caused the stimulation, reuptake of serotonin will occur, thus terminate its action. It is reuptake by a receptor here into the presynaptic serotonergic neuron. Drugs like the SSRIs, atypical SSRIs, and TCAs block reuptake of serotonin back to presynaptic neuron, thus increasing its concentration in the synaptic cleft and its effects. The neurotropic theory of depression explains about the role of B, D, and F. Please refer into your notes. What is B, D, and F? In this slide, basically, you can see the difference between the presence of the receptors on the neuron in normal state, depressed states, and treated states. I hope you can appreciate the similarities between a treated states as compared to the normal states. And also you can appreciate how treatment cause increase in the number of receptors as well as the connection between the presynaptic and postsynaptic receptors. Stress has been implicated as one of the cause or contributing factors to development of depression. In this diagram, you can see how the stress response system works, whereby stimulation to the patient lead to increase in the activity of the hypothalamus pituitary adrenal gland axis, causing increase in the level of cortisol. Can you name some of the states whereby hormones has been associated with increase in symptoms of depression?